Dr. Rath was a close friend and colleague of Nobel laureate Dr. Linus Pauling. His groundbreaking discoveries about the important role of micronutrients in cancer, cardiovascular disease, and other health problems in the early 1990s triggered an unprecedented interest in vitamin research worldwide and led to an explosion of scientific studies. Today, the Dr. Rath Research Institute is one of the leading sites of science-based natural health worldwide. There is a growing interest in the beneficial effects of micronutrients. More and more people take dietary supplements to optimize their health, and therapists apply them as part of disease management. But how do you know if the formula you are taking is truly effective? How do you know it is safe? And how can a therapist determine which products to prescribe now that there are so many formulas flooding the market? Recently, people became concerned that dietary supplements might increase the risk of cancer. The relevant results appearing in scientific literature were highly disputed by nutritional experts. They are contradictory to our own experiences and scientific understanding of the biochemical function of micronutrients. In order to clarify this contradiction, we decided to conduct a fact-finding investigation at our research institute to determine how specific supplement formulations affect our cells. To that end, we compared the efficacy of various supplements on the growth of normal and cancer cells. Tested formulas were selected from popular supplements sold on the European market and supplements scientifically developed at our research institute. What we found is both promising and alarming. First, we investigated the effects of different multi-nutrient formulas on the growth of healthy skin cells, as they need a regular supply of nutrients. Indeed, the products scientifically developed at our research institute stimulated growth of healthy skin cells by 10 to 50%. In contrast, 5 out of 6 commercially available formulas had an adverse effect on cell growth. Instead of supporting it, they suppressed cell growth, on average by 20%. This result is highly disturbing and surprising to many supplement users. So what about the reports that dietary supplements increase the risk of cancer? To clarify this issue, we tested the effects of different supplements on the growth of skin cancer cells. As our results indicate, the supplements developed at our institute and one commercial formula managed to block the multiplication and induce natural death of cancer cells. At the same time, not all commercial formulas have proved capable of killing cancer cells. To the contrary, 5 out of 6 commercially available formulas even led to an increase in cancer cell formation, some even by 250%. Are these alarming results limited to skin cancer cells? To answer this question, we repeated all tests using human liver cancer cells. Again, all tested commercially available formulas boosted the growth of cancer cells, while our scientifically developed products inhibited their growth. So should we conclude that it is better to stop taking dietary supplements? No, that is not our recommendation. Our study confirms that not all supplements are equal in their effects on cells. Formulas that are extensively tested and based on the principle of synergy promote health and counter disease processes. Particular attention should be paid to criteria that determine formula efficacy and safety, including the synergistic interactions of the ingredients, the quality of raw materials, the recommended dose. So how do we explain that so many ineffective and even harmful multivitamin products are flooding the market? Due to the growing interest in the beneficial effects of vitamins, more and more products enter the market. Manufacturers cope with the competitive pressure not by improving the quality of their products, but by lowering their prices. To maintain profit, they use low-quality synthetic ingredients and lack to invest the efficacy of their products. Thus, it is not surprising that their end products are inefficient and even harmful. It is time to create awareness and demand ethical commitment of manufacturers to offer high-quality, safe, and effective health products. Nutritional supplements should be based on scientific principles and presented with scientific proofs of their efficacy. This is not solely important for the protection of our health, but also for the reputation of natural health approaches. Subscribe to our YouTube channel or click here to watch another video.